I'm Emily and I'm going to be doing an IV push medication on Mary Edwards. Okay, some hand hygiene here, and I have Mary Edwards with a doctor of Jessica Smelter, and the order is to administer bumetanide 0.5 milligrams IV push over 60 seconds. So what I have here is my bumetanide. This is 0.25 milligrams per milliliter for IV administration. Expiration date 6/22. And my order is bumetanide 0.5 milligrams. So if this is 0.25 milligrams per milliliter, I need twice as much per milliliter. So I need 0.5 milligrams per 2 milliliters. So I'm going to be injecting 2 milliliters of the medication. And the time is now, so I am going to document what time it is. Perfect. Okay, now I have all my necessary supplies. I have 2 normal saline for flushes, and the expiration date on this one is 5/31 of 23. This one should be the same, 5/31 of 23. I have a 3 cc syringe for the medication. I have a 22 gauge 1.5 inch needle that I'm going to attach to my 3 milliliter syringe so that I can draw up my medication. And again, I'm going to make sure it's bumetanide, 0.25 milligrams per milliliter for IV administration. Expires 6/22. Bumetanide 0.5 milligrams over 60 seconds. So if it's 0.25 milligrams per milliliter, I need twice as much as that. So the 0.5 is going to be 2 milliliters. I'm going to inject 2 milliliters of this. So I'm going to draw this up before we get everything started here. And then at the patient's bedside, we can explain to her what we're doing and why we're doing it. Perfect. All right. Good. Okay, I'm just going to open up my 3 milliliter syringe, and I'm going to open up my needle. I'm going to attach it without touching it. We want this to be as aseptic as possible because we are injecting this directly into the vein. I am going to take an alcohol prep pad and wipe the top of my bottle off. Very good. I'm going to allow it to dry. I'm going to pull back on my syringe to 2 because I'm giving 2 milliliters. And I'm going to inject that air into the bottle because that helps the liquid come out quicker because it creates pressure in the bottle. And wait until you get a multi-use vial that somebody has put too much air into. Perfect. I'm just going to recap that. I'm going to take a piece of tape. I'm going to take my bottle in with me as well. But I'm going to write the name of the med, bumetanide, 2 milliliters over 60 seconds, my initials, the date, and I'm going to stick that onto the cap of the syringe so I can still see the 2 cc's. Perfect. All right. Hello, my name's Emily. I'm going to be your nurse today, and it looks like Dr. Smelter has ordered some medication for you. Can you give me your name and your birth date, please? Perfect. Mary or Mrs. Edwards? Mary. Okay, Mary. I'm Emily. All right, I'm just going to check your name band here. Mary Edwards, 2/2 of 1940, just like you said. Do you have any allergies, Mary? Penicillin. What kind of reaction do you have to penicillin? Perfect. All right, well, anaphylaxis is nothing to play with, so we are not going to give you penicillin today. Good. Okay, what we are going to give you today, Mary, is a medication called bumetanide. That's a diuretic, or in other words, it gets extra fluid out of your body. I see you have fluid overload, which means your cells are holding in too much fluid and you're not getting it out. So we need to give you medication to help you get that out, okay? And that's what this is going to do. I'm going to use normal saline to flush before and after, okay? So we've got one, and then the medication, and then one more flush afterwards, okay? Very good. All right, Mary. I'm just going to double check this one more time here, okay? We have bumetanide, 0.25 milligrams per milliliter for IV administration. Expires 6 of 22, which is in my syringe. And her order is bumetanide, 0.5 milligrams, IV push, which is 2 milliliters, over 60 seconds. All right, and I put the time down that we're going to start this, Mary. I'm going to check your IV site here. Make sure there's no redness, swelling. It's not warm to the touch. It doesn't seem like you have any phlebitis going. That's very good. And there's no infiltration, which means that the liquid that we're putting into it is going into your vein and not under your skin. So that means that the IV hasn't come out from underneath, okay? All right, Mary, what I'm going to do is I'm going to clean your port off really, really well, okay? For about 15 seconds because we don't want to introduce anything in there. And I see you're having some shortness of breath. Okay. All right. Well, the extra fluid in your body can contribute to that, okay? Your labs all looked really good. We're going to keep an eye on your labs and probably draw them a little more often and take your blood pressure more often because you are on amlodipine, which is a blood pressure medication, and this could lower your blood pressure, this medication that I'm giving you, okay? So we want to keep an eye on that and make sure that it doesn't. And then you're also on digoxin, and that in combination with the bumetanide can increase your potassium loss. Right now your potassium is really good. It's 4.2, and the normal level is 3.5 to 5. So yours is right where we want it, and she does have you on a potassium supplement, so that will help too. But what we're going to do is we're going to check your blood pressure more often, and we're going to probably do your labs more often, okay? All right, and this is going to make you feel like you have to urinate a lot. So we're going to have somebody come in and help you, okay? In about 30 minutes after I give this to you, we're going to have somebody come in, and we're going to take you to the bathroom. And we're also going to measure how much you put out. Okay, I'm just going to unclamp this, Mary. All right, and now I screw this on. Very good. I'm just going to pull back a little bit, barely, just to make sure I see blood, and I did. So that means we are in your vein. Okay, Mary, I'm just going to put 3 cc's in here, okay? Turn this so I can see my 3 cc's. There we go. Good job, Mary. You might feel a little coldness. Some people have a weird taste in their mouth. It almost tastes, they say, like sucking on a penny. Okay, I'm going to close that clamp off again so that we don't lose all that liquid we just put in there, okay? All right, Mary, now the next one that I'm putting in, I'm going to clean this off again. The next one I'm putting in is your medication, okay? Now I want you to tell me if you feel any burning, stinging, irritation. If it hurts, tell me, okay? Because I'm going to stop then. This is not supposed to hurt. It might feel a little different, but it shouldn't hurt, okay? Now what I'm going to do is I am going to take my watch off so that I can time this, all right? And since I just touched my watch, and everything has made us very, very conscious of germs, we're going to make sure that we have clean gloves to do this, okay? Because I just cleaned that port off, so I want to make sure. Now, this is your bumetanide, okay? And you're going to get 2 cc's of it, and that's going to go in over a whole minute, okay? So what I'm going to do is I'm going to give you a half cc every 15 seconds. So, in 60 seconds, it'll all be done, okay? All right, Mary, here we go. I'm going to start with the first half cc, okay? All right, here we go. Now you let me know if this hurts, okay? Good job. Doing okay? Okay, here comes the second part. No burning, stinging. Okay, perfect. Now, once you get some of this fluid out of you, very good. Second part's done. All right, here comes the next part. Once you get this fluid out of you, your shortness of breath that you've been having and maybe even your tiredness may get better, okay? Because all that extra fluid in you makes extra work on your heart. And the harder your heart has to work, the more tired you get, okay? And I did notice that your blood pressure's down a little bit and your heart rate's up. So that means your heart's working harder, okay? We want to take some pressure off your heart. And your skin with all your swelling, okay? Mary, you're doing so good. I'm going to clamp you off here. Good job. Okay, I'm going to take this out. And I'm going to clean this back off again. I want to clean it off in between every time I do it, okay? I know it seems like a lot, but it's worth it to make sure that you don't get any infection, okay? Now this last saline flush that I'm doing, I'm going to do it over about a minute again, okay? Just to keep it nice and slow. I don't want to push that medication in too fast, okay? Now, this one's going to go in just like the other one, but just a little bit slower. You got any questions for me, Mary? Okay, here we go. Still doing okay? Good job. Halfway there, okay? Good job. Almost done. Good job. I also noticed that you had some wheezing in your lungs. You feel like you're having trouble getting a deep breath? Okay, Mary, I'm going to clamp you off. Good job. Still okay? Perfect. All right. Now, if that wheezing in your lungs gets any worse, or you have any symptoms that are different from what you were having before, which is your shortness of breath, your tiredness, if you have any more other than that, I want you to let me know. I'm going to get you comfortable here, get you the call light so you can call me if you need to, okay? All right, Mary, good job. I'm just going to clean that off one more time. All right, perfect. Okay, Mary, I am all done. I got you comfy, I got your call light, and I'm going to initial that I gave you the medication at the right time. You are Mary Edwards. You are the right patient, right medication, right administration, right route. Perfect, right documentation. I think I am done here. All right, thank you, Mary. Let me know if you need anything.